You don't have to have something wrong to get this work done. Hormones are messengers, not just within the body, but messengers to us. Our bodies are just doing what they're supposed to be doing. They're responding to an abnormal environment all the time, which is why they're abnormal. Increasing in eating disorders, increase in social anxiety, increase to the point where kids can't even attend school anymore.
Thank you firstly for making it and
Thanks
joining
for having me, Nat.
Yeah. I want to actually start with how we got you on the podcast.
It was a very serious conversation.
So you messaged me and you said, Nat, I want to come on the podcast. And I was like, in my mind, I was like, yeah, of course. But me being me and me being playful, I wrote back and said, no, what did I say? Something along the lines of, we don't invite riffraff onto our podcast.
Yeah. And I understood exactly what you meant.
And you replied with, I know I'm not for everyone. That's okay. And then I put my phone down and I never saw the reply until maybe 5 hours later. And I had, when you have that wave of like, oh, I feel a bit sick because I was joking and you didn't get the joke.
No, I didn't get the joke. No.
And so then 5 hours later, I was like, I was joking. Of course, we'd love to have you on the podcast.
Just so you know, in that 5 hours, I was okay. I had made peace with it. I was like, okay, I love Nat. I'm not for her guests, not for her listeners.
I mean, I don't think you could be any more on brand if we tried.
Actually, I was a bit confused, but then I was like, I don't know, Nat knows what she's talking about. Maybe I do need to look at some PR things going on here.
No, not at all. Well, thank you so much for reaching out and allowing me to call you Riffraff and then still coming on the show.
Of course. Look, it's a privilege to be the Riffraff and to be here.
Amazing.
And to actually I haven't seen you in years.
I know, it's been a long time.
I think the last time I saw you, we were doing that as a speaking event somewhere.
We had to be professional.
We were very professional. That's hard for Nat and I. Yeah, look, it's all smoke and mirrors, isn't it, Nat?
Well, let's talk about you because this is what we're here to learn about and specifically the work that you do. But everyone has a story. And I know it's a bit like, tell us about your journey. For those that don't know who you are, what is the backstory?
Look, there's been, I think with the
How many versions of Sarah Jane are
there's
there?
a lot. There's personal aspects to the story in terms of my own experiences in life and what kind of shaped me to kind of go on my own, I don't know, the best word is journey.
It's the worst word, but
yeah,
it's the
I don't
only
know what
word.
to say.
We need a new word.
Yeah, ChatGPT it maybe. Just experiences in life where I was just like having to, get to know myself, get to know my place in the world, get to know what I wanted to be in the world, who I wanted to be in the world and all those kind of things. I've always been a really deep thinker if you can't tell. And that kind of led me on experiencing many different kind of healing modalities or, wellness modalities from all over the world, not just the West, the Eastern as well. That seemed to make more sense to me than the way our health system functioned here. It still does, if I'm honest. They just understood the soul part, the spirit part, and what you experience in your life is actually impacting your health, your body, your mind.
It's not separate.
It wasn't separate. And, when I first started getting into Buddhism and things like that, they were the first kind of, I guess, experiences that I had where other people kind of felt the way that I felt. And not just from a religious perspective. I don't really look at Buddhism like that, but more just from a belief perspective, a values perspective, how they live their life. They always seemed happier than everyone else that I saw over here.
They had a piece of something that we didn't know about.
Yeah, and you can just see it in their eyes. You can see it when they talk. They've got something that we haven't quite got over here. And, we have so much, but we don't have that. And what's the point of it all if we don't have that?
Right.
So, I first started learning, my first degree was psychology.
I didn't know that until I must admit yesterday.
That's okay. Not many people do. I don't talk too much about it. And I think psychology was just an easy option for me. I wanted to understand more about why I was the way I was.
And probably learnt nothing about the way that you are.
No, absolutely nothing. Learnt a lot about the lobes in the brain and what they believe certain things are. And
which we don't really know. It's just someone telling us.
It's just someone thinking possibly.
One idea.
Yeah, one idea. And they had psychotherapy. I liked the psychotherapy kind of components and what they would deem as mental illnesses and what that was. But it was very, I don't want to say closed, but again, it was diagnostic. And it was like, if you ticked these boxes, that equated to this. Right. And it wasn't about what they had experienced as a person in this life. It was no context involved whatsoever. And I remember they had given the trauma ideals back then makes me sound 100, but when I was studying, it was just CBT. That's all you were taught, really, predominantly as a psych back then. But my minor was world religions and philosophy. So I just kind of blended the two, I decided, and I was like, I don't want to be a traditional psychologist. So I finished my undergrad, went on and did counselling, holistic counselling specifically, which felt, I guess, a bit more holistic. And I got to look at people from all different, perspectives rather than just sitting there and thinking, what's wrong with this person? What do we need to fix with this person? It was more about how can we empower this person to be more of who they are despite what they've gone through in their life, and not look at, traditional health issues, as communications, as information as to what the person's going through and what they have gone through, and not look at it through a lens of bad, look at it through a lens of opportunity.
And just information.
And information. Feedback. And be grateful for the feedback too.
Well, we're so often not grateful for the feedback.
No.
We usually are looking at our bodies going, why are you doing this to me?
The body becomes the enemy. And for a lot of people, their mind becomes the enemy as well. It can be very challenging living in this world for many people. But a lot of people haven't been supported properly through the system that we give them either. Just talking to someone through traditional talk therapy just really isn't enough. And I knew that back then. And that's when I kind of stumbled into chiropractic. I started working for a lady called Dr. Carly Axford, who came up with a technique called spinal flow, which is stemmed off chiro as well. And it's gentle touch. And that's where I went, okay, there's something really beautiful happening here. And not just in terms of their physical health, which is how we traditionally saw chiros, like just body health, but the way that they interacted with the world, whatever happened on the table happened in life and vice versa. You wouldn't see something on the table that hadn't occurred in their life. It was just this beautiful mirror almost, and just an opportunity again to connect to what actually matters. It sounds strange, but for anyone who's ever been on my table, hopefully you understand what I'm saying is you connect to the real meaning of life instantly. Everything else just fades. And it can happen with bad news as well.
Right.
If you get a bad health diagnosis, all of a sudden everything that doesn't matter fades and you realize what's important. But it can happen in a good way too, when you're connecting to yourself from a really deep level.
And so what you're now practicing,
yes,
you've called
Spinal Energetics.
Yeah.
So
explain a little bit more to the person that's listening that's like, what the hell? And, I mean, it's not, obviously it's stemmed from your understanding of the spine and the nervous system.
Yeah.
Can you explain to someone what it is that you're actually doing? I don't know how you do that actually, but that's why you're the creator.
You actually can't. I do my best. But it's always a disservice to it.
Yeah. Well, it's probably no different to trying to describe what acupuncture does, and I sit there and try and help someone understand.
It's difficult to understand something that's not necessarily as tangible as other experiences.
So would you say you're moving energy around the body?
I would say what we're doing is we're working with the person's innate intelligence, their innate energy, rather than moving energy.
Because if I watch when you're actually practicing and what that looks like, some people would say it looks like an exorcism.
Yeah,
like
they do.
What is actually happening.
Yeah.
And actually, personally, I haven't had a treatment from you, so I can't actually, I was like, gosh, that would have actually been smart.
Yeah, we should have done it.
I know, right? But it's fascinating to see how you are, what I imagine, you are moving energy through the body and specifically the spine more than anything.
The spine, and we are working with specific tension pattern points that are specific to certain things as well. So it's not just sporadic movement that we're looking for. We're looking for cohesive movement. We're looking for integrated.
But you're not touching someone?
No, sometimes, but most of the time, no.
And they're having a reaction or a physical, they're physically moving in response to your...
Well, because we think if we have to touch the physical body to get a physical movement. And again, that's from that same idea that we end here.
Right.
We don't. We do have an energetic field. And we're working in the field, and in the field there's different layers of the person and of their experience in this life. And so we can work within those layers to then, I guess, engage that innate intelligence to then express itself in a different way. So I'm not necessarily making them move at all. What happens is I'm connecting to that same part that created that tension pattern, that created that experience. And then that intelligence is actually what's shifting them.
But they're not then just responding to what? Energy.
It's a difficult thing to really nail exactly what
Because
they're responding to.
they're not necessarily in control. The movements that they're having, they're are
not,
controlling
no.
or not. That's right.
But yes and no. So it's almost like, you know how you might get a cramp in your leg and
Yes.
you stretch it out?
Yeah.
The cramp is something that the body's telling you
Right.
as information, but you still actively
Do something.
stretch it.
Yes.
So it's kind of like that, the dance between the conscious and the unconscious. There's a dance between that same information coming through the physical, but it's not just working on that physical layer, because some of the movements people are making just to send it back to the nervous system might be a fight or flight response. So you'll see people kicking their legs, for example. That's information that's them trying to flee a scenario that they never were able to flee before. But what I love about this work is they don't necessarily have to relive it mentally. So their body memory is releasing this, but they don't have to go through that moment in time again where they wanted to flee.
So unlike talk therapy where you'd sit there and you'd talk about it over and over and over and leave just as traumatized as how you started.
Correct.
Which I actually do think is what happens.
Yeah,
I mean, it's great to talk about things and get it off your chest, but that's the
different.
whole point is you're supposed to get it off your chest and leave it
there.
Leave it there.
Yeah.
We don't do that. We're not taught to do that.
No.
And so really what you're tapping into is the body's memory of that experience and releasing it.
Yes. So I believe that the body is almost like a timeline. It's almost like a fingerprint. It's unique to you, and everything you've gone through in your life is within you.
Right.
And you want that. You don't want to forget everything you've gone through. It'd actually be really horrible if you woke up one day
well,
and did.
and yes. And also, I mean, people would argue that things that have happened to them are good, bad or otherwise, but I think it's all working to move you in a direction.
It has to. Look, when you've experienced both, as most, I would say everyone listening has, even during the most painful moments, including the most painful moments in my own life, even now I don't know if I would take it back. And a lot of grief studies say and suggest that majority of people wouldn't take it back. They wouldn't take back the most hurtful things that have ever occurred. And the reason being is who they've become as a result. And I find that such an interesting concept that majority of individuals still would not
That is very
change
interesting because not everyone, I think, has the awareness to be able to, especially in the moment, sit in it.
No.
We avoid it, which is to the point of what you're talking about, like we're avoiding. That's a question I do have because you're saying we store emotions or we store experiences and feelings and thoughts and however we've approach something. And there's also an idea where we shouldn't – I try and not react to things. I try and separate myself from a situation. But that's because probably too many times I've put myself in the same situation.
To try and be equanimous about it.
Right.
Yeah.
So now I'm like, okay, I can see it. Let's just not react. I don't know what to do with that now. I've been thinking about having this conversation with you because I'm like, I've definitely been able to separate myself from the experience and try and take a bird's eye view and not respond or react straight away and just sit there. But I guess that's still part of it.
Yeah.
But if I'm not reacting, am I not absorbing or am I still absorbing that and still experiencing it?
I come to the same thing sometimes.
Because I'm not numb from it, right?
No, but we're also taught in a way not to, like neutralization or being equanimous with everything despite what it is the goal. And I don't necessarily think that's the goal either. I think it's important to express sometimes too. So a lot of the time, even the spiritual, more self-aware people I work with, they've kept a lot inside and they're actually quite repressed because they're trying to be neutral about it and not react to everything, and therefore as a result are actually repressing. What we want is optimal expression and optimal non-expression.
And to move through emotion.
And to move through it and be okay with actually the sometimes people just don't respond, and that's actually a people-pleasing situation as well.
Sure.
Because if I express my true feelings, then consequences can exist. I like to have the response match the context. So if life stimulus is like an 8 out of 10, I would like to think that I can give around an 8 out of 10 response. The challenge is when we've gone through a lot in life and we're hypervigilant, or we can go the other way as well, and we're starting to respond to little things that are really, 1 or 2 out of 10
triggered,
experiences,
so we're idling,
and we're at a 10.
Just our nervous system's idling way too high. Yeah.
Either way too high or no response at all when we should be responding more. I think that's kind of more what I'm talking about, what's storing in that body and storing in that unconscious. just because something happened 10, 15 years ago doesn't mean that your body isn't experiencing it still to this day, even if you did do talk therapy. The talk therapy is working with the mental component. And also what you said before about avoidance, that avoidance feeling is why people don't necessarily want to try this work as well. There's a fear around it, a fear of no longer being able to avoid having to face. They're nervous about what could come up on the table. And they know what could come up is the things that they've necessarily maybe do not want to come up. But that's when we reassure them that they're not specific trauma moments that come up on the table, but maybe feelings, maybe certain emotions that they've not wanted to feel possibly can come up.
What about storing trauma physically? Can that show up as, I'm assuming, pain?
Very much so.
How else is it presented?
It can present in many different ways. So things like fibromyalgia, for example, psychogenic seizures seems to be something that's more on the rise, which is basically, a seizure but it's not epileptic, but looks the same, has a similar experience for the client or for the person involved. It can challenge them because they don't know when it's going to happen, how it's going to happen, and it's usually trauma-based as well. So there's an array of different things that the body stores metaphysically to express. Some go really deeply into it, like if you knock your right toe, that means you're scared of the future or whatever. I'm probably not quite there. But for me, the cases that I have a huge interest in, it's not to say it's not true. I don't know what is true or what isn't, but I'm not completely down that end either. Like, not everything's a sign. Sometimes you just whack your toe.
Yes.
But does that make sense? Yeah. So I think sometimes we're meaning creatures. We search for meaning a lot of the time. But the things that I really love are the cases where they've had all the traditional things looked at and nothing in, so to speak, is wrong traditionally.
Yeah.
So they're in back pain. They can hardly function, just as an example, but your x-rays come back normal, or there's a little degeneration, but not much more to most of the population. They'll start sending them to like a pain clinic or something like that, kind of more that we don't really know what's going on. The idiopathic kind of pain disorders, which basically is a fancy word for we don't know why you're experiencing that. That tends to be more emotional based for me, as opposed to if you're in a car accident and you've hit broke your leg.
Right.
That's a pure physical kind of component. Does this work help with that? Yes, because there's going to be emotional impacts to that. If you can't work for the next 6 months, there's going to be emotional impacts to that, and we need to work with that aspect as well.
So like me hurting my shoulder in Greece.
Yeah, what were you doing?
Throwing a tennis ball with my son in the water. It's small, but it's like the recovery has taken so long.
So yes and no. So one could argue that was there more inflammation in that shoulder?
My right shoulder, so I use it all the time.
Yeah, or is it overuse?
I was throwing the tennis ball in the water. And then because I was like, look at me, I'm such a fun mum doing this with my son, hurt my shoulder. But I was like, but let's just keep throwing it because it's like, that'll get better. Like we've all twinged something before. Yeah. But it turns out no.
Turns out it could have just been you've done something to your arm.
So it was like whacking my toe, or was it that there's something more to it?
I would have to look into it.
Right.
When I feel into it now, there's something more to it.
I'm starting to think this because it's just taking so long. But then everyone's like, shoulders take a long time. I say this to patients, shoulders take a long time.
Yeah. There's so I can feel in the field there's an emotional capacity to it as well. So basically what that means is there was something going on in your life at the time where your innate capacity should have a larger threshold. It should be able to throw that ball quite a bit without injuring. What that tells me is there was something emotional that was already filling your cup in your body, and maybe that's not just emotionally from that concept, but even physiologically. Maybe there was more inflammation through the body. Maybe it was just more susceptible to injury as a result. So it's usually something small, like leaning in the back to grab a handbag. Which
is why we see these jokes of people going, how I got injured today. And it was like, got out of bed, was blow waving my hair, went to grab the glass.
But it's serious. Exactly. I have a lot of clients who've just gone to blow wave their hair one day and then that's that. They've got adhesive capsulitis from there on out. So I do believe that in those kind of cases, there is probably an emotional component that's not allowed your body to have as much, space to overcome certain little things like that. I would say it's taking a little bit longer as well because maybe we're not looking at one of those components. Not to say there isn't a physical component. There is.
Of course, right.
So we don't want to disregard that, but there's something emotional going on with that. So right side's masculine, usually father side, blah, 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 wanting to control the future, trying to get to the future, can't grasp it, can't quite get it, always feeling like you're never quite getting it, even when
Why is it hurting more and more the more you say
Yeah.
things to me?
So that's also not uncommon. So sometimes when we just speak about it, the body reacts. So that's also why people think it's my hands that are special.
Right.
It's not. It can even just be a vocalization, and you can see the body starting to respond. The hands aren't special. The hands are just one way that we can access it.
Right. But your intention is specific, which I would say is special.
Yeah, I think intention is important with this work, especially, there's a lot of people out there who don't really know what they're doing within the energetic field, which, there needs to be more reverence for it than what there currently is. There's a large impact that we can make, and it's important that we're aware of that. Yeah.
So I started really thinking about changes that happen in the body. And then it got me, then I started to think, okay, so it's for women, as our hormones change, I then went, well, hang on, if our hormones are changing, how are we changing? And energetically, what does that then mean? And then because there definitely is a point where women will go, oh, I'm not who I used to be.
100%.
And how much of that, or is it an integration of life experience and changing hormones? And how life experience then actually have an impact on the changing hormones?
Well, they're interrelated. It's just like, when people become a mother, their hormones change as well. It's not just a pure giving birth experience. Their whole makeup changes. And it's purposeful so that you can bond to your child and all sorts of things, make milk, everything that is there so that the child can survive. And so if you speak to a mother, for example, they're never the same person again. For women, for example, who have never ended up having children but maybe have had miscarriages, for example, that hormone changed during that moment in time, and they also would say that they've never been the same person again for a lot of them. So I think hormones in our physiology are a reflection of not just bodily function but also soul function. And I know that can sound quite deep, but you're not able to have a change in soul or experience from that level without also a change in hormone.
Right.
Which is why, like someone like Dr. Joe Dispenza, for example, even on his meditation retreats, they're measuring hormone levels. They're measuring cortisol. They're measuring a whole bunch of different things, and the body responds differently to the experience.
I spend more time regulating someone's cortisol than anything else. People come for hormone support. I will actually be working on their cortisol because the cortisol then dictates what everything else does, right? Yeah. And we know hormones are changing, which are messengers to tell our bodies to do certain things. I wonder how much of this, trauma and nervous system dysregulation is then actually playing into the hormone dysregulation. It's the same thing, really, at the end of the day.
It has to be. I don't have the exact answer for it, but just like you, I would say majority of the people that I work with are more cortisol-based. And that's not to say cortisol is bad. It's not.
No, we need it to make hormones.
Yeah. Like my dog's got Addison's disease, for example.
Oh, bless.
I know. So
there's a dog. I mean, of course, but still.
Don't even get me started. The dog was my mum's. She got an autoimmune disease. Then my dog got an autoimmune disease. Yeah. It's insane. They say dogs are a mirror of their
owners.
Yeah, which makes sense.
There you go. Wow.
So he's on cortisone because otherwise his sodium potassium doesn't work and he can actually get really sick and die. Right. So no hormone is bad. I think a lot of people think like, oh, cortisol, bad. Right, they hear it. It's not bad. It's just we need it at appropriate levels for appropriate situations. And unfortunately, we've created lives now where we're living completely abnormally. Like our bodies are just doing what they're supposed to be doing. They're responding to an abnormal environment all the time, which is why they're abnormal. Like I'm sure you've seen since certain times as well that there's been a lot of changes in the last few years specifically. The last few years have really impacted people mentally, and I'm still seeing that a lot, from increasing in eating disorders, increase in social anxiety, increase to the point where kids can't even attend school anymore, and they're starting to actually have centres or places now because kids won't go to school. It's called like school refusal. Mm-hmm. Again, if you were to look at their hormones and things, there'd be mapping of what's going on. And again, hormones are messengers, not just within the body, but messengers to us as human beings. like what's going on with us.
I think also that, at least my generation and the generation older than us, we were never really taught to deal with emotion. There's a lot of women blaming their symptoms now on perimenopause.
Yeah.
And I'm like, it's just a phase. It's like blaming your symptoms on puberty.
Yeah.
What you're experiencing is an imbalance in a phase of your life where your hormones are more temperamental.
It's also important to note the mentality of women who are going through perimenopause. So it's also a very interesting age where a lot of women leave their husbands, for example.
It's true.
Yeah, a lot of women become single at around the age of perimenopausal. It's also an age where they start to look back on life and what they did or didn't do, what they wish they had done, what they also looking at what options are for them in the future of what they could or could not do. It's different to when you're 20 and looking at your life. Again, those big things like did they have the right partner? Were they the right mother? Were they the right daughter? Did I do what I want to do with my career? There's a lot of those deep questions that come with that age group as well. And so I think there's just such a lack of information around perimenopause that people just assume it must just be.
There's so many layers to this actually, because we were the generation still being like speak when spoken to and, you know, otherwise don't talk, you don't be heard, you should be sitting down politely.
Very different to this generation.
Very different to this generation.
Sometimes I catch myself because of the way I was brought up, for example.
But that's
I never would have been allowed to do that.
Well,
my mum would have told me to be quiet.
My favourite question was, do you want to sit in the car?
That was and it wasn't actually a question that.
But it's like, yes, please, actually, I would love to.
Yeah, get me out of here.
I grew up in Mildura. Yeah. Sitting in the car would have been like a 55-degree scenario. Of course the answer was no. But if I lived my time again, maybe the answer would have been yes, actually, save me from this
get me
situation. Out. But we were very repressed.
Oh, I remember my mum saying, like, I'm going to leave you here if you don't be good. And she stopped the car and she let me out and she actually drove off.
I think I might have had the same thing happen.
And she did come back. But I remember, like, what is going on? And I remember she told me this sounds terrible, but this was quite normal, just so everyone knows. She told me she was going to put me up for sale if I kept being naughty, like give me away to another family. So she put me at the front of the house with a for sale sign on. Like she was quite funny, my mum. But
with a for sale sign? She went to the effort of making a for sale sign?
Yes.
Wow.
She was very creative. And a car actually stopped and I never saw my mum shit herself so quickly and run out and grab me. So I'm like, this is all a facade.
Yes,
I understand what's going on here.
Imagine.
But, you know, like someone could look back and think that's quite traumatic. But, you know, having children isn't easy.
No, it's not. No, it's definitely not. And it's definitely, things have changed. You're right. Like I wouldn't say to my children in front of other people, don't speak unless spoken to.
No, it's definitely changed.
And that's changed. And it was just generationally appropriate at the like that. No one was questioning it. I'm not saying that my parents did a bad job.
No.
I mean, look at me. They did amazing.
Look at us. They did a great job. We still don't know how to express ourselves and Nat's arm's sore.
I'm very grateful for the childhood experiences I had. It was just a very different time to be alive. There was a lot of repression. So it's no wonder women of my age and the next generation actually don't understand themselves, are very disconnected from themselves, want to find the answers that we're seeking really blow my mind. Could it be this? Could it be this? Could it be this? It's sort of like your body's giving you messages.
Yeah.
Lean
Most
into
people
it.
don't even know what that is.
It's very true too. And you don't know unless you know.
No. They don't look at it as a message. They look at it as something going wrong.
Punishment.
Yeah, punishment. Why is my body doing this to me? And they separate themselves from the physicality.
Yeah.
And we are more than just our physicality, but the physicality is an expression of more, you know.
So what are some of the things that patients will come and see you for now?
Oh,
reel off some things for that listener going, all right, hang on, is this for me?
A lot of different things. The main things are people who have tried traditional methods that haven't got relief. So then they come and see me.
So whether it's pain, whether it's an autoimmune condition.
Autoimmune has gone up quite a lot as well. More those stranger things that haven't healed when they're supposed to, so to speak.
My shoulder's hurting less.
Yeah, I know. I reckon we could sort that out, but we'll get into that. It's funny that it was with your son because your son's actually a mirror of what that reflection is as well. Yeah, so even the
anyone that's got a sore shoulder, off you go. You're welcome.
Yeah, it's interesting. and the meridians that run through there and all that kind of thing.
Mhm.
You know what I'm talking about, if anyone does. I'm never really the first resort, although that has started to shift in the last few years, but I was always a last resort. People would describe it as, we don't really know what Sarah does. She calls it spinal energetics. We're not really sure. Sometimes she touches you, sometimes she doesn't. It's a bit odd, but go and see her. So what was very interesting to me is that people didn't need to understand it. What they needed to feel was different, and maybe the symptom changed, for example, and that was enough for them to then almost, I don't want to say believe, but it is that kind of concept, believe in the concept.
Or just know, maybe. Have a knowing.
Just remember that it's not always something outside of yourself. Some people as well, they've been put on medications that weren't working or had side effects that were kind of detrimental to them.
Yep.
But a lot of emotional stuff now as well, a lot of anxiety, a lot of OCD, ADD, a lot of those kind of things as well, which we can assist with. And it's not to say that not suggesting that we cure these things or whatever, but it's about what can we do to help them live their life more optimally, from people who can't sit on the toilet seat properly otherwise, from people who had never slept more than 5 hours uninterrupted, for people who could never look to the left and right driving their car, to people who have been in relationships that they know have not served them and never loved themselves enough to actually put themselves first and find someone.
And then, just as I'm conscious of time, what about the person that's wanting to prevent something from manifesting?
Yeah, this work does that too.
Of course, it's about awareness from the beginning, right? Knowing I'm either about to face something really heavy or I'm in something really heavy.
There's less storage.
That's what I'm getting at, yes.
Yeah, less storage. So there's not so much repression or so much overly, hyper-vigilant expression. It's bringing it into optimization, homeostasis, that kind of ideals. And so that's why I still get the work done. You don't have to have something wrong to get this work done.
Right.
I do it as part of my health regime, just like brushing your teeth. There's nothing wrong with my tooth right now, but I brush it every day to assist me with that.
Well, my daughter was asking last night when she was doing her pre-school year homework, what is homeostasis, Mum? And I was
Good question.
Oh, do I have to relive this again? But this is what you're talking about right now.
Yeah, we want optimal function. And also the less that's stored, the less communication your body has to express to you. And when I say communication, less symptomatology.
Lovely.
So I do believe, and again, this is my personal philosophy, but it's how I live my life, it's how I dedicate my life, is that the more I am aware, the more I am working with the experiences and what I have experienced and what I possibly will experience, and even what I'm experiencing at the present moment, the more I believe that I'm allowing it to move and shift through me the way that it can, so that it's not there later for me to deal with. And I believe when it is later there to deal with, that's when the consequences are a larger consequence. Doesn't mean it's comfortable at the time. It's not. And, it never ends. I always think, like, I've dealt with my dad's stuff, and then the next week, no, apparently I didn't. So it's not to say that you become a perfect human, but what it is to say is that you're almost expanding your toolkit, and you're expanding that space that I was telling you about, for example, with your shoulder, that your body can react appropriately. It's very unlikely to see something happen out of nowhere with people. They've usually had a lot of trauma or a lot of stress in their life. And then this becomes an expression of that. And that's not to say it's the only thing. There are other things, but we know now we can change our genes. We can change the way that they turn on and off. We're very complex. And I don't think that we give ourselves enough credit emotionally, mentally, and also energetically, how that can be a really missing part of our health puzzle. And you'd know that as an acupuncturist. Acupuncture's lucky it's got research behind it, and people don't really think of it as an energetic modality because you're sticking a needle into the physicality.
Right.
So when I'm working off body, that's even more, strange. But essentially, like, acupuncture is something that I compare it to, but you guys call it chi. Other, places in the world call it prana, kundalini, whatever you want to call it, life force. The essence of who you are and the essence of the energy in the body, because you're alive, is what we're working with. I couldn't do this on a dead person.
No,
their life force is gone. Their chi is gone. It's like acupuncturing a dead person. We need to work.
You're working with their vital force.
Correct.
Love it. Thank you so much for joining me today. This has been excellent.
We're very professional.
I know we were very professional.
Thank you, guys.
For those listening, if you've liked this episode, please go ahead and let us know what you liked about it.
Yeah.
Feel free to leave us a rating.
A good one.
Yeah, a good one, of course.
Yeah.
We only accept the good
We only
ones.
accept the good ones.
But thank you again, and until next time, bye.
Thanks.
Easy. Thank you. That was excellent.